Hello everyone, my name is Dr. Guo Jianhuan. I'm in Winnipeg. I come from Ankang Acupuncture Healing Center, Canada, and also I'm the president of the Dr. Huang's Minizeng Acupuncture Association of Canada. Today, I'm very pleased to have a chance to share my presentation to introduce Minizeng Acupuncture Therapy. Minizeng Acupuncture Therapy, I believe it is a must key to treat soft tissue pain disease. Based on my 20 years experiences and research and study on soft tissue pain disease, I found the Minizeng acupuncture. It is very effective, very safe acupuncture technique to quickly release the pain, and also it can help to achieve the best long-term result. First of all, I want to introduce the definition of Minizeng acupuncture therapy. Basically, Minizeng acupuncture therapy is developed on the basis of 9 types of traditional Chinese acupuncture needles to target superficial, the facial nodules, muscle spasms, scar tissue adhesion, and the myofascial trigger points. It is a very effective, revolutionary therapy to treat various soft tissue injury, pain, nerve compressions, dysfunctions, etc. So when I talk about the Minizeng acupuncture therapy, most of you don't know what it is. You may want to know, how do I use this technique to treat the pain, the disease? So next, I would like to play some videos and then let you to know what it is. First of all, here is my patient's testimonial, talk about his experiences in the last 6 years in my treatment to help his soft tissue pain. Because he is the hockey player, he has lots of injuries from the hip joints, the thigh, adductors, and every time when he's got injured, he will come to my clinic, and I always can help him. What he's saying.
Hi, my name is Travis Ridgen, and I'm a professional hockey goaltender. I play pro hockey over in Europe, and I've been coming to Ankang Acupuncture for over 6 years now. Groin issues, knee issues, hip issues. Doc fixes all of them. There's nobody I trust more than him. I know it says in the building top acupuncture clinic in Winnipeg, but it truly is the top acupuncture clinic in the world. I've been to places in Vancouver, Europe, US, everywhere. Nobody compares to Doc. He is the best of the best. If you have an issue, I guarantee he'll probably be able to fix it. This is why I go to Ankang Acupuncture, and this is why you should as well.
So from his experiences, because he's playing the hockey of the world, he went to the Vancouver, Toronto, Europe country, United States. So he can compare the differences of my treatment and from other acupuncture therapists in other clinics. Here is my next patient's testimonials. Because her knee injuries has been almost 3 years, and before he came to see me, she was almost disability from her injury. And after my treatment, and then her condition is getting much better. So that's why she was so excited to make this video for me.
Hi, my name is Sharon and I am from Winnipeg. I fell at work 3 years ago on my knee. I was unable to walk around. I was constantly having knee pain, knee swelling. My knee was constantly knocking out on me where I was unsure of taking my next step forward. I seeked out medical treatment. I was doing physio twice a week for basically almost a year. Been followed by orthopedics. I was then referred to orthopedic surgeon, and they suggested to have knee surgery, and that was going to be involving anchors and about 6 weeks of bed rest. Could not do that, so I knew I had to seek out other treatment. I began to do my research on acupuncture, and I came across Dr. Hung, and I decided I have nothing to lose at this point and everything to gain. Day one when I seen him, I was unable to walk. I can't do any kind of bending, no twisting, so I've been taken off of work. I've been off work 14 months. After my third treatment, I no longer had the pain. My knee was no longer knocking out on me, and I could feel I could take one step forward without any concern whether or not my knee was going to give out on me. Acupuncture has been my lifesaver. Thank you very much.
So from her experiences, that my treatment really helped her to back to work. So actually in that clinic, we have lots of chronic pain patients. They need our help. But honestly, our traditional acupuncture treatment, most of the time for this kind of chronic repeated injury, we can do things are very limited. So that's why I would like to introduce this new technique to our acupuncture therapist, because that it is very important to help those patients to achieve the success and help them to back to normal life and help them to back to the work. Okay, from those testimonials from my two patients, you may want to know, hi doctor, how do you use that minimizing acupuncture treatment to treat your patients? So here I have some that case recorded when I give my patient a treatment. So you may understand a little bit before I literally introduce that minimizing acupuncture therapy. This part. Okay.
Right here.
Okay.
Where
Good.
that pulls here.
Pause here.
Right
Okay.
here.
You can do it. Where's pen?
Okay, right in there.
Right here, right?
A little bit. Yep.
Right here, right?
Yeah.
Okay, good. So you feel that your neck still, right? All uncomfortable. So yeah, just I want to make a turn this way. Do you feel that? Can you feel?
Yes.
Here, okay. How about go this way? Can you feel? That's
I still feel it.
Feel
on the
that
same
here?
side, yeah.
Okay. How about up? Can you feel that?
Yeah, that's not as bad.
Okay. How about back? Down. You feel that?
It's kind of on both sides.
Yeah. That's it's better.
Yeah, I think it's better.
Yeah, it's gone on, right?
Yeah.
That's great.
I get some tingling sensation in my side of the head and above the ear and the hairline. So
Anthony? Oh, just once a while.
every day I get it.
When you turn side?
Yeah, if I'm sitting here for a while like this and I hold it down,
Yeah.
then it starts to tingle.
Where's tingle exactly tingles?
It'll tingle through here,
Okay.
up in the hairline. It feels like something's crawling under the skin.
From skin, yeah?
Yeah, like right in here, right now, I can feel it.
Oh.
Right there, it's tender.
Good tender here, right?
Yeah.
Yes, good. Oh yeah?
Yeah.
Tender too, right? Oh yeah? Right? Tender, right?
Yeah, I can move it in the head. Sometimes it takes not even 30 seconds.
Seconds, eh?
Like sometimes if I'm doing something in the kitchen,
Yeah.
making something to eat or something, I got my head down, I heard it start and I can feel it.
Okay, but so far you don't
So
feel
far I
it.
don't feel it, but I've got a question for you. When you were working here,
Yeah?
it felt like you were scratching the bone.
Yeah.
I could hear it in my head, like,
Yes, you can
Yeah.
hear that, yes.
how come?
Yeah, that's
It's just a nerve.
yeah, magic. Yeah, it's a magic. To see which way you feel more pain.
That's kind of tender that way.
So-
More
Which way? You
on the thumb, like more up here.
into like this, feel more pain here?
Yeah,
And which way?
it's like it's more in here, like more by the, I guess by the bottom of the joint. I think is more.
Yeah, so that I mean, right? Yeah, we are a bit swollen here. Okay, tender here.
Tight there, yeah.
Yeah. It's okay.
Yeah, I think it's just like I say, it's the pain, not as much pain, but it's just stiff.
Yeah. We are done today.
Okay, so here we have a total 4 videos. The first video, so I treated the lady. She had the shoulder pain because her pain limited her range of motion of the shoulder. And then second videos, I treated one patient. He had a neck and shoulder pain. So when she turned his head side to side, he had pain around the neck and the shoulder. And the third, the patient, because he suffered from the nasal occipital nerve entrapment. That's why he felt that the sensation tingling on his side above the ear area. The last one, the gentleman has the thumb joints, the knuckle, the pain. Actually, he also had the issues around his elbow. That's why with minizing acupuncture treatment, we achieved immediate result and their condition getting better right away. So that's the way we use minizing acupuncture treatment without retaining needles inside the bodies. We don't have to wait 20 to 30 minutes. And also we don't need to use any cupping, massage combined with technique. And all the patients can get result right away. That is the advantages of this technique because it can save lots of treatment time and no waiting 30-40 minutes to see the results. No downtime for patients. And also that as a therapist, it is very simple and easy, to achieve the best result. Okay, next, let me to introduce the features, mechanisms, and principles of Mini-Zinc acupuncture therapy. First of all, I would like to introduce the principle of Mini-Zinc acupuncture therapy. Mini-Zinc acupuncture therapy is that integrates traditional Chinese and Western medicine. Is based on the four core series of abnormal tension theory, adhesion scar theory, the facial trigger point theory, and the three-dimensional meridian theory. These four theories explain the occurrence and the development of the pain, as well as the source and conduction of abnormal tensions. Through superficial puncture, Mini-Zinc acupuncture treats deep pain to restore the tension balance, eliminate inflammation, and improve blood circulation. So it eliminates the pain and nerve compression quickly to achieve remarkable, timely, and long-term results. So this is the principles of Mini-Zinc acupuncture therapy. The features of Mini-Zinc acupuncture therapy. It has, first of all, the needle tip is only 0.35 to 0.5 millimeter. So when we give the patient the treatment, the patient will feel a little bit pinches, but this kind of pinch is very mild and tolerable by most of patients without any the painkillers or other medicines. This treatment may cause a minimal the bleedings, just like our regular acupuncture therapy, even all no bleedings. So these techniques can avoid secondary adhesion the damage from that the regular live needling therapy. The third is the treatment process is very easy and pleasant. Each session of the treatment lasts only around 2 to 10 minutes. It depends on how many parts the treatment we need. If just one part of treatment, just like before the shoulder pain, maybe just take around 2 or 3 minutes, we'll finish the treatment. Of course, if patient has more parts of pain need to be treated, and then maybe take around 10 minutes. But treatment frequency is once every 3 days or once a week. So the general course of treatment can be 1 to 3 times, and most of pain patients will get much better. So with this very efficient treatment, you can take 30 to 50 patients a day. Should be no problems at all. Next, the treatment process is very safe because the needle insertion depth is typically less than 1 centimeter, and of course will not damage any big nerves or important blood vessels in the deep layers. So compared to regular acupuncture therapy, most of the time we have to insert the needles deep to almost half inch, 1 inch, and 2 inch, 3 inches. But this usually less than 1 centimeter. And also, this treatment method is very simple because when we put needles to treat the target, we only need the up and down insertion, so without retaining the needle in the body. So there's no need for long
longitudinal or lateral peeling. No need for other auxiliary treatment methods such as massage, cupping, etc. So that's very, very safe, the procedure, and an easy procedure. This therapy supplies very accurate treatment by finding the diseased or injured muscles of fascia based on patient's execution of the movement. So just like first video, we ask patients, to do the range of motion test of the shoulders, or the gentleman had the shoulder pain, neck pain. We got the accurate assessment to find exactly where is the damage is, where is the pain is. So from these techniques, we can supply very accurate assessment and diagnosis. And then we can apply the accurate treatment. So treatment target tissues include deep or shallow injured fascia or skin, injured tendons or ligaments, the shallow muscle attachment points, trigger points, or on the top tender muscles, and cutaneous nerve compression sites. So all this kind of damaged pathological tissues are the targets for the minizing acupuncture therapy. So with this treatment, the curative effect is immediate for most of the soft tissue injury pain, because we treat the cause of the chronic pain, so that long-term effects are even better. From these techniques, the diagnosis and treatments are objective and reproducible. The treatment effect can be confirmed by whether the painful nodules are limited or not, based on testing with your fingertips. So that the feature of this technique is that when we treat a patient, your fingertips tell you if the pain getting better or not. Even before the patient tell you, oh, I'm getting better, my pain is getting better. No, you know already with your treatment. You don't have to wait the patient to tell you that. And also, I say most important is this techniques. The theoretical basis is simple, objective, and scientific. You don't have to guess. You don't have to, looking for the ask points or looking for some specific acupuncture points to treat the pain, because those kind of points may work, may don't work. So that's different. Okay, so next I would like to talk about what's the core mechanisms of the minizing acupuncture therapy. So core mechanisms are, first of all, to correct the mechanical imbalance caused by soft tissue lesions. And second is to eliminate inflammatory reactive substances that cause the pain. It is impossible to treat the deep tissue lesions in the shallow layer through the bony leverage, the mechanical contraction or traction of the fascia, and the traditional Chinese medicine three-dimensional meridian series. These techniques fully considering the human body's repair function and self-regulation functions. So minimizing acupuncture therapy will maximize the self-healing capacity of the human body. So that's why the minimizing acupuncture therapy is very safe, the technique, because it treats the pain. But most of the time, we want your body itself to heal the pain, not from needles. The more is minimizing acupuncture can directly relieve the superficial myofascial tensions at the point of attachment of the strand muscles to relieve the whole muscle spasm by mechanical contraction. Because these needles, when treat the trigger points on top end of the muscles, it not just break up the trigger points, and also it can stimulate the muscles, and then that muscle loosen up. At the same time, minimizing acupuncture can also directly break up the painful or tender nodules and scar adhesive fiber tissues in injured muscles or the tendons. Directly remove the pain-causing factors. I say abnormal tension trigger points to eliminate the pain. There's no need to pick a non-needle to penetrate the whole spasm muscle to avoid lots of needle pain. Because when needle is longer, its insert is deeper, of course, the patient feel more pain. That's why the advantages of this therapy are its minimum and tolerable the pinch, no risk, and simple operation. It truly achieves the purpose of simple, convenient, effective, and inexpensive medical treatment and opens up a new concept of treatment of various soft tissue injury pain. So this the advantages of the minimizing acupuncture therapy. So here, I would like to introduce our 4 series of minimizing acupuncture. First one is abnormal tension theory. Second one is adhesion scar theory. The third one is myofascial trigger point theory. The fourth is three-dimensional meridian theory. First of all, let me talk about abnormal high tension theory. Because most of the time, we believe that the chronic pain caused by the abnormal tension in the injured areas of soft tissues. So how the abnormal high tension be caused by the injuries? Because first of all, we all know when the soft tissue get injured, and then that it will get inflamed, it will cause edema, swollen. Because when edema happen, and then it will increase the internal tension. So that's the one way cause the high tension in the pain area. And also, if the muscle tissue damaged, it can cause spasm and contraction of the muscles. This spasm and contraction also increase the external tension to the pulling pain. In case the connective tissue get damaged, also it can cause scar tissue formation. From scar tissues, it also can increase the local volume and size, and then increase the tension. And also, the tumors, the bone hyperplasia, etc. When the nodule formed, it will increase the volume and size, and then increase the tension. Other issues like scoliosis or spinal curvature changes. It will cause the change of attachment. The muscle tone of the transfer process and the spinal process will change, and also it will cause high tension. Otherwise, the fractures, artificial joint replacement, after injury or fixed attached muscle tension will also can cause the changes of the tension. In addition, the texture of skin changes, such as hardening or curling, also can increase abnormal skin tension. So this tension also can transfer to deep the tissues of the fascia, the muscle, the tendons, the ligament. So all these reasons can cause the abnormal high tension, which cause the pain. Second theory is adhesion scar theory. Because just like I said, when we get injured, our soft tissue get injured, and then the inflammation, edema will occur. Because our tissue will heal itself. So the consequences of that the healing is scar tissues. So when scar tissues happens, if the scar is small, just like for example you cut your fingers, they're very tiny small, so this should not cause any issues. But some injuries, for example, like sports injuries, the wound is very big, and then it can cause the massive injury, and then this scar tissue could be very big. Just like I said, when soft tissue get injured, it will cause inflammatory edema, and then those kind of exudation to surrounding the tissues, like collagen fibers, penetrate into the surrounding normal tissues, like blood vessels, nerve tissues, fascia, skin, tendon, etc. And then it can cause scar adhesion. When scar formed, it will cause the compression and also pulling the normal neurovascular tissues. So that's why caused compression. The symptoms could be the pain. If compressed nerves can cause tingling, numbness. If the compression on the blood vessel, it can cause cold hands, cold feet, or cold sensations. So that's why when soft tissue get injured, the scar tissues can cause secondary the problems to the normal tissues. That's why it could be that the cause of chronic pain. Here I have the three pictures of the balloon. So first picture, the balloon is normal, is circle, the air inside, and the shape looks very beautiful. Here we have tap on the balloon, and then when this tap just represents the scar tissues. When it's tap on the balloon shape will be changed, and also tension inside will get changed. That is kind of scar tissue, like in our body. And also the pictures also show the scar on the balloon, but because direction is different, so the scar has different impact on the balloon depends on directions. So here I say this illustration simulates the impact of scar adhesion tissue on soft tissues, appearance and function, compared with longitudinal scar tissue. Horizontal scar tissue has a greater impact to harm the shape and function of the tissue of the body. So with the treatment of the minimizing acupuncture therapy, most of the time we target this kind of horizontal scar tissues instead of longitudinal scar tissue, because horizontal scar tissue has a greater impact to harm the shape and function of the soft tissue of our body. I hope you can understand this kind of scar tissue, how to impact our normal tissues. Next, let me talk about the myofascial trigger point theory. We all know the myofascial trigger points is the main issues right now that in our chiropractors, physiotherapists, massage therapists, they are working on this kind of pathological nodules, which they believe cause the pain. And also some articles believe that the 95% of chronic pain caused by the myofascial trigger points. Here, I would like to just introduce briefly about myofascial trigger points, because you can find tons of that literature, the data and articles from internet. But here, I just introduce the basic of myofascial trigger points. First of all, we all know it has two different types of the myofascial trigger points. One is active, one is latent. Active trigger points, usually that those kind of trigger points on the muscle taut band. It is kind of very painful, the nodules, and also when you press it, it is very tender. And also, if you press around 10 seconds or 15 seconds, it can cause referral pain and radiation pain to some place of the body. So latent trigger points, they are also on the muscle taut band, but they don't have pain, only have the tender. When you press it, the patient will feel the pain, but it is also kind of nodules. So, to my understanding, the latent trigger points are the cause of active trigger points. So, if you want to treat the pain patient, we'll not just treat the active trigger points, and also we have to treat the latent trigger points. That's very important. Of course, some researchers also indicated that the trigger points could be central trigger points or affiliated trigger points, depends on the location of that trigger points. So most of the time when we talk about the active trigger points, we always mean that the nodules or the pain is on the taut band, on the muscle of the body. But actually that they believe that some trigger points is on the tendons or the muscle insertion or end points. Generally, the active trigger points that have few characteristics. First of all, it is very painful and also very tender. Second one, it is kind of swollen the nodule. It has high tension. So when you use fingertips to palpate the trigger points, you will feel the nodules, the high tension underneath of your skin tips. From our biochemistry studies, some researchers find that in the trigger points, it has very low the pH, and also it has very high acidity. And also lots of research indicated that inside of the trigger points, it has high concentration of inflammatory pain substances. And also they found the blood microcirculatory disorder inside of the trigger points. So we understand this, that is very important. Why we use the mini-zinc acupuncture treatment to treat the trigger points. Because this needle has very tiny blade on top of needles can directly to break up this kind of trigger points and then to wash out those kind of inflammatory the chemicals, pain substances, and then that the pain getting better, tension getting less, blood circulation getting better. Here, the pictures about trigger points. So this kind of, that the nodules there, trigger points, this kind of taut muscle, and then trigger points is on taut muscles. And then that you can see the contraction, the knot around here. And normal muscles, we don't have this kind of knot. And these pictures show something. It will show taut band in that muscle. Sometimes we call trigger point complex. And then that it is active focus of trigger points here. That means very painful. So here is normal the muscle fibers. And it is kind of contraction, the knot. We call the nodule. So that's why at the fingertips, you can feel, or you can feel this kind of nodules underneath of fingertips. And also when you compress it, and patient will feel very tender, painful. So next, let me talk about three-dimension meridian theory. Why I should talk about this kind of things? Because this theory is important for us to understand why we only use mini-zinc acupuncture treatment very superficially to break up those nodules and then to treat the deep tissue pain. Because from our traditional Chinese medicine and acupuncture, we know that the meridians are three-dimensional system, not the flat system. So we have to understand that. Meridians are connected to each other in three-dimensional spaces between Zhang Fu, inside, outside, left, right, up and down. So from our traditional, the Legion and or acupuncture, the series, we all understand that. Physiologically, the meridian is the path of the qi, the blood flow of the nutrients. So it is kind of transportation system for our nutrients, for our blood, for our energy. But in case something happened in our body, some disease or injuries happened, and then pathologically the meridian is the contact path of the disease and evil. So lots of pathologic energy could be transported from the meridians, inside, outside, left, up and down, so can cause more troubles too. To my understanding, the meridian is also the conduction pathway of abnormal tension after soft tissue lesions. So most of the time we just think about that okay, if some that organs like heart, gallbladders, livers get injured or damaged, and then we have some points specifically to show some pain. For example, if you have a gallbladder problems, and then that around the Yangling Quan we have that the nodules or tender points we call Yangling Xue. And then when we use regular acupuncture treatment for the gallbladder disease, we always choose this kind of specific points to treat the gallbladder disease. To my understanding, the Yangling points actually it is kind of that the pathway of abnormal tension from the gallbladder go to that Yangling points. So that's why that when we treat the Yangling the points, our gallbladder condition disease will getting better, the pain will getting better because that points or meridians after stimulated, the pathologic energy has been released from the point, and then the patient feel better. So that's why I say the diseased meridians may form 5 impediments like skin B, vessel B, tendon B, muscle B, and bone B, which interact and transform with each other. Because traditionally we have the 5 layers of the pain called 皮壁、脉壁、经壁、肌壁, and 骨壁. So that's why those kind of B, because energy and blood vessel has been blocked, cause the B, cause the pain. So this pain all interacted and can transform from the meridians. That's why we have the concept we call the pathogenesis points. That means painful nodules on acupuncture points are signs that illness is unable to go out of the body that cause the pain. Just like Danang points, it is kind of the Danang disease, which the pathological qi can't go out of the body, and then the Danang points occur with tender and pain. And also when the pipette, it has a big nodule in the Danang points. So that's why that I believe that abnormal illness, the nodules, are also one of the targets of medicine acupuncture therapy. Okay, so here that I just want to show that our bodies have 3-dimensional, that is pictures like that. We have sagittal plane and coronal plane and also transverse planes. Our meridians actually exactly the same. They have the 3 planes. Okay, so they are not just flat, the double dimension. It actually is a triple dimension of the system. So here, I would like to have a summary of this 4 series. Why this 4 series is important? For us to understand the cause of the pain and the treatment of the medicine acupuncture therapy. For example, here, we have the trigger points, the tenderness and the pain from the trigger points. Here, adhesion scar tissues, pain, nerve compression from scar adhesion tissues when soft tissue get injured. And from the meridians, first of all, this all can cause abnormal high tension in the pain areas. And I say from the 3D meridians, and then it can cause the local, symptoms, and also can cause distal symptoms. So local symptoms, that means that the injury happened in the local part, the pain happened in the local part. The distal symptoms, I mean that could be, for example, if you have leg issues, sometimes patients maybe have a pain on the heel. So when we treat the heel pain, maybe we never can get any success. And then when we treat the neck, and the heel pain could be cured right away. So that is very common. And from my experiences, I found lots of time when we treat the heel pain, ankle pain, the knee pain, I treat the hips, I treat the low back, I treat the neck. When patients have the wrist pain, maybe I treat the elbow. When patients have elbow pain, I treat the shoulders and neck. So that's kind of local symptoms and distal symptoms. They all could happen at the same time. But we have to understand what is the cause of the pain, what is the symptom of the pain. So if we understand the relationships among these 4 series, we will get ideas how to find the cause of the pain, how to treat the cause of the pain, and how to achieve the long-term benefit. So here that talk about the meridian series of Huangdi Neijing, and here I don't have to repeat. Okay, next, I would maybe to talk about application of manual acupuncture in my practice, in my acupuncture clinic. Because in my clinic, my patients, 70-80% are pain patients. So every day I use manual acupuncture treatment to treat those kind of pain patients. So I would maybe that to play some videos to show you how to treat those kind of patients. First of all, let me talk about manual acupuncture treatment to treat soft tissue injuries. Just like I have talked about before about manual acupuncture treatment, most of the time we treat soft tissue injury pain. So once the soft tissue injured, the pain could be, for example, of course, pain and tenderness, right? The pain is patient's feeling, oh, I feel painful. The tenderness is that when you press it on, that on part of the body, the patient feels, the pain. So that's the way differences of the pain and the tenderness. It may cause nerve compressions, I say. If that, that the scar tissue is formed and then compress the nerve, and then the patient may feel tingling, numbness, yeah, or sometimes they feel maybe dizziness. Okay, it could happen, or migraine headaches. And also that when soft tissue get injured, some patients also can develop some kind of physical motion dysfunctions, like limited of range of motion of the shoulders, the neck, the hip, the ankles, the knee joints, could be all cause problems. And also, some patients after soft tissue injured, they also have some kind of autonomic nerve dysfunctions, not just because of tingling, numbing of the compression, and also patients may have anxiety, depressions, heart palpitations, sweatings, all this kind of autonomic nerve dysfunctions. So from our manual acupuncture treatment, when we treat those kind of soft tissue injuries, we can also resolve those kind of problems.
the pain, the tender nerve compression, physical motion dysfunction, and the autonomic nerve dysfunction, blah, blah, blah. So 4 clinical features of soft tissue injuries, just I mentioned already: tenderness, the main sign of diagnosis and judgment of the treatment outcome. Second is nauseous, because some patients, they will tell you, hey doctor, I have pain on my chest, for example. This kind of the nauseous or locked is very painful, very tender, cause me like I get, that heart attack. Actually, that I just treated a few patients, last weeks, when they just told me that her left side chest is very painful, just feel like heart attack. And then after I checked up, I found some nodules, that just in front of the chest, maybe around that 6 or 7, the rib side, just close to that sternum. And after my medicine treatment, and then pain disappeared. And when she come back yesterday, I asked her. She said, no, the pain is gone. She come back again for the neck or shoulder pain. So that is very, very effective. And then, of course, as I say, pain. The pain could be active pain, passive pain, or resistant movement of injured muscles. So when we treat the patient, some patients will tell you, when I move, that, for example, shoulders, and then sometimes when you stretch the part of front chest, they feel pain. This could be that the pulling or passive pain. But if that biceps got injured, and then we carry some stuffs, they have some pain. That could be active pain. So that we have to understand different kind of pain. Dysfunctions, just I mentioned, because range of motions could be very limited. So that some patients, they can't do fully range of motion. For example, shoulder flexions, extensions, abductions, adduction, internal rotation, external rotation, etc. So lots of patients, have different kind of motion disability. So that is very common. So with medicine acupuncture treatment, we can quickly resolve those problems. So it is remarkable success, much better than traditional acupuncture treatment, much better than dry needling treatment. So how to assess and make diagnosis of those kind of soft tissue injuries? Of course, we are looking for the pain, the tenderness, and the tight muscle. So according to the location and the moment, locate the injured muscle, which may display the tension as abnormal tension, spasm, swelling, and tenderness. Because when the muscle gets spasm, you will see the injured muscle maybe a little higher than that, other side of the muscle, or when palpate, it's harder than another side or not tissue, or normal tissues around that swollen areas. Even you can feel the skin is harder than the surround the skin. So they are different. When we're looking for the muscles, we are looking active muscles. And also we are looking synergistic muscle. And also we are looking antagonistic the muscle. They're all different. So we have to identify this muscle pain is contracting muscle pain or pulling muscle pain. So that's active and passive pain.
And then with acupuncture, with the minute acupuncture treatment, we can directly break up the tender nodules. And also, it can directly break up any abnormal nodules at the point of the muscle origin insertion site. From this way, we can quickly relieve that pain from the muscles. For example, if you have the biceps muscle pain, we are looking for that, that the insertion short head of the crocus process of the scapula when we use the minute acupuncture treatment to break up the nodules around that areas, and then that the bicep pain, muscle pain will get better right away. And also that we use minute acupuncture treatment to break up the myofascial trigger points on the muscle spasm, taut band, and ligament, and then to quickly relieve that trigger points pain and also muscle spasm pain. Okay, here's a video. I want to show how do I treat the low back pain.
Okay, come back. Yes. Yeah,
So this patient just coming to my clinic.
You have pain right now?
Yeah, it's in the left side.
The left
or
side,
the
eh?
right.
Okay, sure. Let's go.
Her moving is very slow. I checked her that that range of motion.
Backward. Can you do that?
No, that's not bad.
Okay.
Backward's
Okay.
fine.
Over side to side.
Like this?
Yeah. And can you have?
That's not too bad. A little more this side. Where it
Okay.
pulls up here.
Okay. How about bend side to side?
Ooh,
Where?
that hurts. Right in the middle of the back.
Oh, sure. Turn over. Let me see. Show me where's pain.
Right there.
Okay. On this side.
And this, yeah, on this side, on that, when I do that, this is not as bad.
It's all here, right?
It's all right here.
Okay. Okay. Gotcha. Okay, sure. Maybe take pants off. And now stomach.
Yep.
弯腰痛，所以我主要是在这个。Go here. It's quite right.
Yeah.
Yeah. Sit here. 这边。From here.
No, that's okay.
Yeah. Okay. From here. Yeah. Okay.
Oh.
Yeah. 它这边也痛啊。Very sensitive, eh?
Very sensitive.
How about here?
No, that's okay. That's not too bad.
Not too bad. 它有那个，所以更多的这个对它那个有帮助。快速治就是把这什么地方把它解开就行了，不要太多太破坏它就会常常烫伤它。
No, I was just trying to get the paper out of my face.
Yes. Yeah. I feel that too. Yeah. Are you yeah. Okay,
Yeah.
you can go. Stay a bit here. Look few steps. Say how.
Yeah, it actually feels better already. I can't believe that.
You can be right. It's better already.
Feels a lot better for sure.
Yeah, you can try the bend a little bit forward a little bit. Oh, much easier.
Much easier.
Much more.
Yeah, how the side to side again.
I feel pop.
But it feels that way.
It popped a bit there, but that's
Yeah.
yeah, much better. Oh my god, I couldn't even do that before. Perfect.
We did this
You do this.
again.
Thanks so much. I used to walk fast. Trust me.
Yeah, try. Go ahead. That's great.
Much better.
Well done.
Okay, so from this case that I can introduce you guys how to do assessment of the pain patient. Because her low back pain, you have to do that range of motion test first of all. Ask patient, that first of all where the pain is, and ask patient to do, the inflammation. Oh, sorry, to do the patients, the bend forward, backward, side to side, left side, right side, and twist left side or right side. Okay, so we have to assess the range of motion of the low back. And also when patients lie on tables, we have used our hands to palpate that, the whole areas to find where is the pain part, where is the high tension is, where is the tender is. And then with the needles, we quickly find those kind of abnormal high tension nodules, use needles to break up those kind of nodules, and also use needles to stimulate those kind of spasm muscles without retaining needles inside the body. So after that, and then when we finish treatment, we don't have to use cupping, we don't have to use electricities, we don't have to use a massage. We can get patients get up right away and then do the test to see how the patient. So we can compare right away that the result. So these patients before treatment work very slow, after treatment work very fast. So that's the immediate result we can get from the minute acupuncture treatment. So it is very, that miracle. Sometimes I say that the patients always say, "Oh, you're a magician, you're a miracle that treatment." So that's we can achieve right away. Which that usually um, traditional acupuncture can't do that because most of the time you have to let the patient stay there, insert needles inside, and maybe hook on the electrical wires, and then that 30 minutes cupping, massage, and then the patient get up, like 40, 50 minutes, maybe still pain, lots of pain there. So that's the difference. Okay, so second, we are talking about minute acupuncture treatment. It is very effective to treat the nerve in treatment conditions. As an acupuncture therapist, we always say, that in China, when we compare the pain, the tingles, and numbness, we always say the pain, oh yeah, it's kind of maybe not very serious. But when the patient feels tingling, that way, oh wow, the pain maybe a little bit serious than the pain itself. But when patients tell you complains of numbness, we always think, oh, it's very complex, that conditions to get treated. That means it's not easy to treat. So compared to pain, tingling, and numbness, we always think the pain is most easiest to get treated. And then tingling, the second easiest. The numbness is most difficult. But from the minute acupuncture treatment, most of the time, as long as we can find the place where the nerve has been compressed, and then we use minute acupuncture needle to release those kind of compression and scar adhesion tissues around there, and then patients, the tingling and numbness, we're getting better right away. Here, that's some words I want to just read it. Nerve in treatment is one of the most common conditions from soft tissue injuries, which cause fluid penetration to surrounding nerve and blood vessels, as a result forming adhesion and scar tissue that compress nerves and blood vessels, presenting the pain, the tingling, and numbness. The most common nerve entrainment disease include, for example, greater occipital neuralgia, like the migraine headaches, right? Supraorbital, neuralgia, the patient always have pain on the front, that always say, okay, from eye, above the head, and then go to the side or go to the top of the head. That's most of the time we call that the supraorbital neuralgia. Sciatica, very common, and cervical nerve the compressions. Some patients feel maybe tingling, numbness on the hands, on the fingers, on the arms, on the shoulders. Or median nerve compressed, ulnar nerve compressed, or radial nerve compressed, tarsal tunnel syndromes. When that happens, patients feel tingling, numbness on the bottom of the feet. So this is very common, in the clinic. But most of the time, 99% I say with traditional acupuncture treatment, the result is not good. But with medicine acupuncture treatment, we can achieve the fabulous results in nerve entrapment disease by breaking up those adhesive scar tissues to relieve abnormally high tension and to release compressed nerve fibers in order to remove all the symptoms of the tingling, numbness, and the pain. And also that the minute acupuncture treatment, it is very good to fix the the breast pain. This breast pain is very common in many women, and it is often associated with the menstrual cycles. However, some severe persistent breast pain and swelling may be associated with localized soft tissue injury, resulting in high tension from the injured pectoralis major, pectoralis minor muscles, and the back muscles. It is also one of the reasons causing hyperplasia of the breast. So when patients feel that the cyst in the breast or pain in the breast, that could be the reason from soft tissue injuries, not just from the hormones. Medicine acupuncture can directly break up the scar tissues and loosen up the tight, injured muscles to relieve abdominal high tension in order to help achieve immediate pain-free results. Actually, that with medicine acupuncture treatment, it can also help to cure the breast hyperplasia and the tumors. Because this hyperplasia and tumors could be triggered from the soft tissue injury, the high tensions, and then just like a chain reaction to develop those kind of cysts or the nodules in the breast. I remember before I treated one lady, that young lady around 23 years old, she suffered the breast pain over 7 months before come to see me. At that time that her pain every night before bedtime, she started to feel the swollen and sore of both the breast, and it is hard for her to have good sleep. Almost 6 months. She tried to see that all specialists, the chiropractors, massage therapists, acupuncture therapists, none of them can help her. And finally, find me. And then I used the medicine acupuncture treatment plus some Chinese herb medicines. Just a few sessions, her pain is 80-90% better. And then after 5 sessions treatment, her pain is completely gone. So she was so happy, so excited, and teared after her pain is released, because it is quite suffering for her. 7 months. It's incredible. Here, maybe that I would like to show my treatment to treat that thoracic outlet syndrome. This lady, she's the owner of the salon, the hair salon in the mall. She is the hair stylist because she has been working on this career over 20 to 30 years. That developed her problems, tingling, numbness on her neck, right side, and also shoulder pain, arm pain. It's hard for her to sleep, and she was disability from these problems. After assessment, I give her diagnosis is that the thoracic outlet syndrome, because the nerve has been pinched from that thoracic outlet, and then from her that I clean that the anterior muscles. So I give her the treatment, and her condition was getting much better after around 6-7 sessions. This was the last session of the treatment.
然后这个病人主要是就是我们叫胸廓出口综合症，它主要是就是颈神经压迫，然后嘛就引起了他的那个肩颈部和上肢的那个就是压迫症状特别明显，疼痛特别明显。所以呢，治疗几次以后现在非常非常好，所以今天呢再给大家再给治疗一次。 this is the we call the thoracic outlet syndrome, which the cervical nerve has been pinched, by spasm muscles. So patients have lots of symptoms of the pain and tingles and numbness on the neck and the armpit. So after a few session treatment, it's much better now. So today we still have to do more treatment.
And once more in French.
Oh, I don't know French. Can you speak French to me?
No, I can't.
No. Yeah, I believe that this one also will do kind of party. There.
Actually, this lady that she does not need us, but for her treatment, she give me that maximum cooperation, and then that help me to achieve the best result. And because when we treat the neck areas, our technique should be very gentle, very superficial. We just need to, that penetrate the skin. That's enough. We don't have to go to deeper. So the treatment depth maybe just around maybe 5 mm or 6 mm instead of 10 millimeters. Of course, when we treat the refrain part, that the cricoid process there, and then maybe you can go to maybe, that 0.5 centimeters or 5 mm, and then that the patients feel better right away. So basically, the patient was very happy after that finished the treatment, and her condition is getting much better.
Okay, and then one more time here. Okay, we're done.
Yay!
Yeah, after treatment, she was very happy, and anyway, that because not just because the treatment is finished, and also her condition was much better. So that's why she was so excited. And after treatment, and then she came back to work. So that's why she really excited. Okay, before that, when we talk about medicine acupuncture treatment, we talk about soft tissue injuries, no compressions. Actually, that in my clinic, we also use medicine acupuncture treatment to treat lots of that ENT the problems like eye issues, tonsillitis, and the deafness. And because clinically, almost 30 to 40% of ENT diseases and of the molecular diseases are caused by cervical spondylosis. Because if that occipital muscles are strained with that inflammation, spasm, adhesion, etc., they may cause tension imbalance, compress nerve and blood vessels, and then present a series of ENT and other mixed symptoms. The eye conditions, for example, the first cervical transverse process syndrome can cause long-term pharyngeal discomfort, tinnitus, and the deafness, blindness, and vision loss, etc. And the medicine acupuncture can directly break up the scar tissues, release the tight muscles, and rebalance muscle tension to remove the compression on the nerves and blood vessels in order to improve the ENT in the eye the conditions. So I have been treating that many patients, suffering from the eye issues and tonsillitis, and seems to work very well because most of the time when we use traditional treatment, it doesn't work. Typically, when patients tell you that when they move the head on the side to side or up and down, they feel that uncomfortable, on eyes and the ears and tonsillitis, you can tell that those kind of problems caused from that, the soft tissue injuries, not from the eye and the ear itself. Okay, so that you can tell. So next, that I maybe that talk about it more about the different case studies. This ladies, that she had those kind of that we call seven transport process syndromes, and also she suffered from the optical the neuritis and aphasia. So she lost her vision. Before she come to see me, she didn't tell me that. She just come here for the pain, of neck pain, shoulder pain. So let me see.
I felt very well after treatment, no pain at all.
Yes.
And,
How about dizziness?
dizziness gone.
That's great.
Yeah, so no pain. I'm saying I felt very, very well.
So that we can do the treatment again today. That we'll see what happened. Okay. Yeah, that's great. So that we just give it time. You can change same as before, just lying stomach facing down.
So she come to my clinic because her husband come to my clinic for his no back pain. And then that he come here to see me.
There's nerve here, and they can cause eye aches, can cause headaches, can cause neck pain, can cause shoulder problems, all from there.
Where is C3?
Yeah.
Where is C3?
C1. C1.
C. But I saw one
Here, around here.
This is 3. And where is 1?
Yeah.
Oh, this is 1.
That's 1.
And
Just
where is
behind.
3?
Straight down a little bit.
Do you
This way.
okay.
Yeah, where I see.
Okay.
Very, very close. It's hard to make just the 1 centimeter differences from 1 to 3. Come down.
Yeah, her treatment because her husband come to my clinic for that his no back pain, and after that few sessions, her husband much better, and then she come here to see her neck pain, shoulder pain, but he didn't tell me that her vision issues. And after a few sessions, he told me her vision was getting better. Surprised. And then that I just got her that all that the pictures and data from her eye doctors. And then that we just make this kind of case study. Okay. She come to my clinic is January 29, 2019. She was at 46 years old at that time, and her main complaint is the right eye optical neuritis for 8 years with headache, dizziness, blurred visions, diagnosis as the anopsia. And her right side, shoulder, that is tenderness at the right tip C1 transfer process with tight muscle beside C1 to C7 spinal process. And treatment, we use the minimizing acupuncture. And after that, the first 5 session treatment, that she gave me that those kind of eye exam from her eye doctor. Before the treatment, her right eye and left eye, that lots of dark spots, dark parts, that are in her eyes. And then that's this kind of visions, that this kind of gray, that's the black, because her right eye almost blind, and her left side eyes, some kind of dark part there, but maybe her vision is a little bit better than right side because here a little bit wider. And after 5 session treatment on her the neck, and then we can tell we can see her black parts much less than before, almost 80% better. And also first time to show some kind of white part here. Her vision got back a little bit more. And also from her left side, her vision is getting much better before maybe this size. This is almost double size of the, the bright side. And after 10 sessions, and her black parts only maybe around 10% left. And also here, compared to first time, the right side, that only that little bit left here and here. And also her left side, the black almost gone, just a little bit there. So let me move this to my pictures. Yeah, so that here that only a little bit left here, and also better, lighter than original, and also white part is almost 80%. So after 10 sessions, before she come to my clinic, she was a disability from her vision issues, and after that the treatment, and then she can go back to work. She was so happy. So that's, I say, from Indian acupuncture treatment, we cannot just treat that pain, and also we can treat the ENT issues. We have lots of different kind of videos. Maybe we can share in the future. Okay, so that we talk about that all that the Indian acupuncture treatment, that the applications in the clinic. So next I would like maybe just talk about that some cautions, some kind of information of that Indian acupuncture therapy. I want you understand a little bit more and what it is Indian acupuncture needle, how to perform it, and what's the precaution before and after treatment. Okay. So first of all, we talk about that what's a Indian acupuncture needle. So from before we talk about lots of the theories, clinical applications, treatment, procedures, and lots of videos. You may be wondering what the kind of needle it is. This needle, is kind of we call small size, that we call the blade needle, developed from 9 needles of the Huangdi Neijun. The regular size of the needles is 0.5 to 0.35 to 0.5 times 25 millimeters, just like Wing Chun acupuncture needles. So, because it has a tiny blade on top of needles, that's why it has that not just have the stimulation to the points or muscles, and also it has that cut off the functions. I said benefit, to break up those kind of scar adhesion tissues or trigger points. Right now that in my clinic, that we sell this kind of needles because this needles, the brand name called Zaogu, is made in the China using advanced German techniques to ensure the needle, the blade is sharp and smooth with minimum pain or pinches. So this Zaogu brand needles has been approved by Health Canada and FDA of the United States of America. Our clinic, Ankang Acupuncture Healing Center, is the only one exclusive appointed agents to sell the Indian acupuncture needle in North America. Okay, so there's 2 needles. This kind of box, the package of the needle. This kind of the needle itself. One pack we have 5 needles. So for treatment, usually one patient we use maybe 1 or 2 needles or 3 needles, depends on needles qualities, or depends also that how big size of the treatment we need. So that's why that it is very how to say that also we save lots of needles from regular needles, because when we treat the patient with regular acupuncture treatment, at least we have to spend 10 to 15 to 20 needles for each patient. But for this kind of treatment, we only use 1 or 2 medicine needle instead of 10 to 20 regular acupuncture needles.
So before that, we do that the minimizing acupuncture treatment, we need to do some kind of assessment, diagnosis, and treatment. So from this way, and then we can make accurate treatment. So the procedures is like when patients come in, you have to ask patient to fill the form, the initial assessment, that the form, and then to get patients the complaint, what's the problem, and then that we have to see the patient's the moment, the actions, and we check up, that any kind of dysfunction of the range of motion, and then we have to figure out, what kind of pain it is. For muscles, it's kind of pulling pain or contracting pain, active pain or passive pain, and then after that we have to put patients in the suitable the treatment positions for different part of the body. Sometimes we put the patient in on supine position if we treat the front part of the body, and then put the patient on the that prone position, for the back treatment. And after that, we set patient in the proper the position, and then we have to clean that disinfect the skin, use alcohol, that to clean the treatment areas, and then that we use. And when patients tell you that pain areas, we have to use our fingers, that up and down, that with a moderate the force, quickly slide over the skin and find the stiff muscles and protruding the nodules, to see where is it the hard skin or soft tissue, where is the nodules, because the nodules where is the pain or that kind of the tender nodules. And then that when you find treatment targets of those nodules, we use a thumb, index fingers, and middle fingers to confirm the nodules for before treatment, and also that we have to double check the muscle, the tight muscles or muscle spasms, and then that press the treatment side with that your thumb insert the medicine needle to cut off the painful nodules. When we performing the treatment, you should hear that crunchy sounds, like cutting the crunch sound, like catch, 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 catch. In order to really aid the therapeutic effect after treatment, have the patients get up and repeat the action that was painful before the treatment. Just like the ladies, before you couldn't, bend forward, or very difficult to bend forward for flexion, of that, number, that range of motion. And after treatment, and then ask patients to repeat this kind of difficult part, and then to see any improvement. If the pain is gone, that's perfect. If we still have pain left, and then we can give any extra operations. After treatment, if patient still that the complains a little bit pain left, and then that we can try to find the painful nodule near the pain areas, while the patient holds the painful posture or position as you break up the nodule by needles. That means that when patients, for example, if you have pain, when patients bend forward, when once bent, go to the certain the angle of the inflection, for example, and then patient say, okay, my pain is there, and then ask patient to stop, hold the position, the painful positions, and then ask patient to tell you where the pain, to point out, and then from there, and then you can go up a little bit to find exactly the nodules will cause the pain at this posture or the angle, and then use needles, just to break up those kind of nodules, and then that pain should be getting better right away. So and then you can ask patients again and again to do it. But most of the time that we say, if patient feels that 70-80% better, that's good enough. We don't have to always try 100% patients, 100% pain-free, because lots of soft tissue injuries, not very simple, very complex. Because when that we treat this part getting better, maybe some part maybe that show up some kind of pain. So we don't expect 100% every time. So when patients feel 70% better, even 60% better, that means our treatment is success.
Of course, if you can choose 100%, it's a miracle. And then you may ask that how to find the minusine acupuncture treatment targets, because we say our minusine acupuncture therapy is focused on the treatment, to break up those that the targets or tender nodules or scar tissues. How to find them? So first of all, we have to understand our body is that stand up back, a person. So our gravities always, cause no part of body, take more of the stress from upper part because of the gravities. So I say that we are upright, walking animals. That's why that no part of body always take more stress, the tensions from that our weight. Similarly, though soft tissue may be injured on the upper part of the body, the pain will occur on the lower parts. For example, if the leg was injured, the symptom may present as no back pain, hip pain, or leg or foot pain. As I said, from that three-dimensional the meridian series, because the pain could be that transferred from that local areas and then remote areas. That could be that different. When we apply the minusine acupuncture treatment to treat the chronic pain and want to achieve the long-term result, the treatment target should be always on the above or proximal the tender nodules, which is the source of the pain. So this that you have to understand. What I mean is that if a pain, for example, that in the number areas around maybe L4, L5, for example, maybe the cause of the pain is L1, L2, or maybe that from the T10, T11, T12. You have to move up to find the source of the pain in the number. And the next is that how to operate the minusine acupuncture needles. So to operate the needles, use the right thumb and index fingers to grip the flattened part of the needle handle, because our needles have the specific, that handles. When that has been flattened, so you know the directions of the blade. And the middle fingers to touch the needle, the body, here. Yeah, touch the finger, the bodies. To control the insertion depths, use the wrist force to perform needle up and down insertion. At the same time, use the left thumb to press the treatment areas to prevent the movement of the target, the tender, the nodules. So we need two hands work together. So you want to practice and these techniques, it's better, just like our traditional that acupuncture that practicing in the lab, that it can make a solid the caution to practice operating minusine needles to strengthen the wrist force. Because when we use the force, we have to hold it tightly and then suddenly to that give the force to the needles and not they quickly break up the scar tissues and the trigger points, penetrate the skin to reduce the pinch, the pain sensation from needles. But of course, we have one kind of needles with a tube, just like a regular acupuncture needle tube. You can also use that one to to tap it, and then that needle quickly go inside. But this sometimes it's difficult to find to hold the nodules. So I think that we still need to practice with our fingers and then to insert in the right direction, right depth, and to achieve the right result. Precautions before the minusine acupuncture treatment. So this is just like a regular acupuncture, that the precaution. For example, don't treat patients with the infection disease malignant disease or patient with acute fever or acute inflammation disease. Don't treat that patient with who is overly hungry, very full after meal, extremely tired or nervous. So don't treat this patient at the moment. So you have to ask patient to take a break and that drink some water if they are hungry, or give them candy. And or if they are very full, just ask them, maybe that take 10-15 minutes, ask them to walk around. If they're extremely tired, let them just sit there, drink some water. If they are very nervous, just explain to them and try to give very minimum treatment, as less as possible. Let them to feel more comfortable. Don't treat the patient for the pregnant woman. Usually, I don't treat that pregnant woman with medicine acupuncture needles. And also be cautious with the patients who have the bleeding dysfunctions. If they are taking that blood thinners or have the bleeding dysfunctions, of course, we still can treat those patients with medicine acupuncture therapy, but be cautious, that you should know they have the bleeding issues. And also be cautious with patients who have serious skin infection, ulcers, or tumor. Okay, so we can treat this, but we should be careful. And also, we should be careful to treat the patient who has serious diabetic hypoglycemia. If they are the blood sugar level is very high, more than 14, 20, don't treat those patients because it may cause, in case cause of the infections, maybe it's hard for them to cure, to heal. And also be cautious, for deep insertion near the large vascular vessels or nerves. So typically that for those kind of growing areas, that those kind of blood vessels, those kind of arteries, veins, and nerves, be careful. So this kind of things, just like that. Okay, so that I mentioned before that with medicine acupuncture treatment, we do have some pinchment, that some patients feel that kind of be pinches, that from needles. That's very common because it has very tiny blade on top of the needle. That's why when we treat the patients, we should be gentle and slow, and also that we don't have to up and down very fast. And then we should take slow that space, that to walk on the needles. We can count 1, 2, 3, 4, that to up and down to break up those kind of the nodules. And so with this slow the path, and then the patient maybe feel less the pinch. Typically, that if that treat exactly on the tendons and nodules, the pain is not too bad. Most of the time, because pinchment happens because of the needle may pinch the blood vessels. Those kind of the capillary, the blood vessel. And also that if the needle that inserted to the accurate place, nodules and depth is less than 1 centimeter, and then pain is very less, very minimal. Of course, the needle that the blade, the quality, it is very important, because if the quality of the blade is not sharp enough, not very smoothly, it can cause lots of pain. So that we have to choose that the best quality that the medicine needles. And also another tricky way you can do is that give the patients a candy during the treatment. First of all, that when patients have a candy, they just feel funny, they are happy, they are laughing. That could be the way to relieve, to minimize their anxious and nervous. Even just feel like joking, oh, he gave me candy, I'm 40, 50, 70 years old. why do I need candy? Yeah, when you say, do you want a candy? They're laughing, ha 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 ha, like that. And also, yeah, give them a candy. And the candy, say when the blood sugar goes a little bit higher, it really can maybe that trigger your mind has less pain sensitivity. They feel less pain, less pigment. So that has double the benefits. Give patients the candy before the treatment. So, and also that the third, the benefit is that it also can prevent the fainting, because some patients when they're nervous may feel some pain. Sometimes maybe patients may easy get fainted when you have the candy in the mouth, and then when the blood sugar a little bit high and the sweet sensation in the mouth, it helps them to prevent the fainting, that reaction. So that's very important. So the candy can really help us to perform medicine acupuncture treatment. And after treatment, what it should be, what you should do, or what should be careful that the patient, you have to tell the patient what they should do. In case that during treatment, patient have some bleedings, you can use that, the clean that the cotton ball, to press 1 or 2 minutes to stop the bleedings. And also that in case you worry about maybe infection of the treatment, that maybe you can use a polysporin, that to put on top of the treatment areas to prevent maybe infections or pain. But generally, if we use an alcohol to disinfect the treatment areas, we don't need that. But in case you want, it should be okay. And of course, if the patient has serious post-needling pain, patients can take some painkillers. It's okay, because occasionally happens is that after patient treatment, and 95% patients getting better day by day. But some patients after treatment, maybe first day, even they feel pain getting worse. Then they will complain, hey doctor, after treatment, why my pain is getting worse? But surprisingly, the day after that, 1 day after, their pain should be much better. So this time you have to tell the patients, okay, so before getting better, maybe getting worse first. Okay, sometimes we say no pain, no gain, and then no problem. So tell them, let them, that understand, that could happen before they're getting better. So it is very important to communicate, very clearly and understandable, to let them know what you are doing, what do you expect, and what they expect. Of course, if the pain, if the treatment areas, after treatment have some swellings, yeah, they can use the ice pack to put on top to reduce the swelling. It should be okay. Some patients ask, the after treatment, can I take a shower? Yes. If that treatment is that, that everything's good, no any side effects, nothing wrong, patients can take shower, no problems. After treatment, 1 hour, 2 hours later, they can take showers. But only thing is that don't that patient drink any alcoholic beverage, okay? Because alcohol can maybe trigger the pain sensations. That could happen. That for any treatment, acupuncture treatment. So yeah, after treatment, tell patients don't drink any alcoholic beverage. And also the treatment interval between each session, that maybe 3 or 4 days should be okay. I mean, treat the same place, Okay, but if we treat different part of the body, for example, today you treated the leg pain, next time you treated come here for shoulder pain, that once every 1 day or 2 day is okay. And if you treat the same places, maybe it's better to take 3 or 4 days, because as I say, this medicine acupuncture treatment is the best the techniques that to treat the pain by our bodies that the healing ability to maximize our bodies the healing ability. So during these 3 or 4 days, your bodies that take time to adjusting, to rebalance, and then to heal itself. So that's very important part. Okay, so far that it is almost 2 hours that when I give this lectures. So I give the last summary for medicine acupuncture treatment. Because here we just that introduce the introduction, the basic of that information of the medicine acupuncture treatment. So for the real course of training course, we are teaching that all soft tissue injury the issues from the top of the head, the neck, shoulders, arm, elbow, hands, and go to the back, chest, stomach, low back, and growing areas, the knee problems, ankle problems, that we do have very detailed the training course. But from today's that the introduction, I just want to say, medicine acupuncture technique is a very safe, efficient, and precise tool for treating soft tissue injuries and related illnesses. That's why I say that not just for the pain, and also treat that nerve compression. We can compressions. We can treat that the range of motion problems. We can treat that anxieties and also depression. We can treat ENT problems. Or could be that soft tissue injury related. And the medicine acupuncture treatment, it has the stimulating effect of other ordinary acupuncture needles, and as well as a cutting function that the regular needles does not possess. This makes it particularly effective in treating stubborn chronic pain caused by scar adhesions and trigger points in the fascia. So that's why I say medicine acupuncture technique is an essential skill for all acupuncturists, both in China and abroad, for the treatment of soft tissue injuries and the related illnesses. So this is my summary of the medicine acupuncture therapy.